I'm not going to take off my mask even when speaking, so please do not take off your masks even when you take the floor. The situation is very difficult, which means that our slot is very limited, our time is limited, so please do stick to your allotted time. I even have a bell. I will try to refrain from using it, but on the screen the time will be displayed.
Mamy do zatwierdzenia protokół.
The minutes of 12th of October are to be approved. Any comments? Doesn't seem to be the case in the room. Anyone online? The Secretariat has just told me there are no comments, so the minutes have been adopted, the minutes of October 12th. Dear colleagues, as you know, we are having a hearing today on beating breast cancer. It is taking place within the context of the October Breast Cancer Awareness Month. Every year we hold a campaign to increase awareness of the disease. We are working together with the FAM Committee. So I'd like to welcome Evelyn Regner, who is here with us today and who is the chair of the FAM Committee. You have been promoting the European Gender Equality Week, and it is within this event that our hearing is taking place today. Breast cancer is a very common disease affecting women in the whole of Europe and worldwide. Every year there will be in Europe alone more than 300,000 cases. So just to give you a comparison, it's as if a whole town fell ill, such as Nice, Bilbao, Florence, or Szczecin in Poland, which is my hometown. It's as if everyone in the town of that size fell sick. So it's a big killer, which destroys people's dreams, which destroys families, including families with children. We need to tackle this challenge as politicians. We need to come up with the right strategy to beat breast cancer and any other type of cancer for that matter. It's our dream that one day cancer at least will be less devastating a disease than it is now. I would like to give the floor to Evelyn Regner, who is the chair of the FAM Committee. Unfortunately, we do not have much time because of COVID-19, so please be concise. I give you the floor.
I just would like to say thank you very much for this invitation. Dear colleagues, thank you for joining the first European Gender Equality Week and participating with such an important topic as talking about breast cancer. Gender Equality Week is about gender, it's about equality, and it's about awareness. So thank you for associating the FAM Committee and giving me, as chair, the possibility to address some very short welcome words to you. Before, I quickly want to address an important topic at the moment, Poland's so-called constitutional court banning safe abortions. With this, not abortions are banned, but safe abortions. Women will be pushed even more into unwanted pregnancies, unsafe ways in abortions in Poland, or if economically possible, to leave the country to get a safe abortion. This ban sacrifices the health and the life of Polish women and shows how deeply rooted misogyny still is. So we also should condemn the unjustified police violence against the protesters trying to defend women's basic reproductive rights. So I call on every one of you to stand with the Polish women and to take action. But of course, I come back to the topic to talk about breast cancer briefly. Too many women every year face this challenge. In the European Union, and too many die because of late detection or insufficient health care. Coming from Austria, I know how important screening is. In Austria, a preventive screening program was started in 2014. For all women aged 45 to 69, a mammography is free, and they are invited per letter every 2 years to get a mammography. Also, younger or elder women can request such a letter, and thus the program covers all women over 40. Result: more women get screens and are aware of the risks, but the goal has not yet been reached. So now I'm very curious to hear what the experts are telling us about this and where to improve the current situation. And again, congratulations for choosing this issue.
Bardzo dziękuję.
Thank you very much. Thank you very much for your words. The experts are indeed with us today. As a chair, I will refrain from talking directly about what's happening in Poland, but thank you for your support to the Polish women. Those are difficult times for my country. Now I would like to introduce our speakers. With us today we have an excellent panel that will give us information on research, prevention, detection, shared knowledge, equal access to treatment and support to patients and caregivers. I would like to welcome our speakers who are with us online. Dr. Isabel Rubio, Director of Breast Surgical Oncology at Clínica Universidad de Navarra in Madrid. She is also a professor of surgery at this university and the president of the European Society of Breast Cancer Specialists. Our second speaker is Jürgen Van Pret, Managing Director of the Think Pink Europe, the umbrella organization bringing together 38 organizations in 24 countries. Pink Europe focuses on reducing disparities to access healthcare between European countries. Following those two statements, we will have a discussion with our coordinators and rapporteurs, who will each have 1.5 minutes. And then we will have the replies. So I give the floor to Ms. Isabel Rubio. Are you with us, Professor?
Yes, I'm here.
Okej, słyszymy, wszystko dobrze.
Thank you. And I would like to thank the Special Committee on Beating Cancer of the European Parliament and the Committee on Women's Rights and Gender Equality for inviting me to share the challenges and opportunities in breast cancer. I'm a breast cancer surgeon working in Madrid, Spain, and I think that we all together have the opportunity to improve breast cancer patients, a disease that represents the most common cancer in Europe and a rare cancer in men. So every breast cancer patient has the right to access to the highest standard of care in a specialist breast unit with dedicated breast specialists working with a multidisciplinary approach, including patients in early, advanced and metastatic breast cancer. Breast cancer is one of only 3 cancers that there is a robust evidence that the benefit of the screening is there, but not all European countries have population-based screening mammogram programs. The USOMA requirements of a specialist breast center has been recognized by the European Parliament in many resolutions, but by 2020, the provision of breast centers in accordance with the EU guidelines has been missed in many countries. In a survey by Europadona national patients organizations, only 55% of European countries have breast units, and only 34% of European countries have a certification unit. Very few countries operate a systemic audit on breast cancer services, and some countries don't even have a national cancer plan. This implies that many women are not offered high-quality breast cancer surgery and optimal use of systemic treatments or targeted therapy. Many European societies and patient advocates are working in a breast cancer surgeon certification, so all breast cancer patients will have a quality cancer surgery regardless the place where they live. EUSOMA will continue to promote the certification and implementation of breast units with more than 100,000 patients with data monitor. We also need programs and legislation for breast cancer survivors, as it increases progressively with 1 to 2 million of breast cancer survivors. Breast cancer diagnosis has devastating repercussions on all the aspects of patients' life. Yet, cancer survivors are not legally recognized as a group with special needs in this matter. Approximately 56% of breast cancer patients are in a working age, but fewer than two-thirds have returned to work or are working 1 year post-diagnosis. Only 55% of countries have legislation for breast cancer survivors' right to return to work. Only 42% of countries have legislation for survivors' right to access insurance. In many European countries, a legislative framework is still not placed or remains ambiguous. Only 12% of European countries have passed the right to be forgotten. That concerns the financial toxicity and specifically the possibility to get access to mortgage, loans or life insurance by cancer survivors without being penalized by their disease. Can I have my slide, please? And then, to finish with the challenges, an adequate reimbursement to optimal breast cancer care. In the last European Breast Cancer Conference, the EBCC12, a manifesto was launched regarding the need for all breast cancer patients in Europe to get the most appropriate care. Many reimbursement rules for breast cancer care are not in line with evidence-based medicine and clinical practice guidelines, favoring inpatient versus oral systemic treatments, favoring mastectomies over more conservative surgeries with oncoplastic techniques, seeing risk-reduction surgery for mutation carriers as no disease, or no adopting the state-of-the-art in radiation therapy. Reimbursement aligned with optimal clinical practice guidelines can drive more cost-effective care, which will improve European cancer outcomes. I have one slide that I would like, if someone can put the slide, please. So we have many opportunities. I think that policymakers and politicians need to ensure that all women and men with breast cancer in Europe are treated in a specialist breast unit that meet all the requirements to deliver high-quality breast cancer care. Acknowledge the evidence that treatment in multidisciplinary units lead to overall cost savings as well as higher quality of care. Audit the current national provision of care using accredited auditors. The breast units can be the source to collect breast cancer data to establish a European breast cancer registry. Development and implementation of programs and legislation that support breast cancer survivors to return to their work, and reimbursement and funding balance with the new diagnostic and treatment approaches. In the era of COVID, it has been clear that breast cancer units can be the place to guarantee the health of breast cancer patients, reorganizing in any pandemic the pathway for keep as much as patients diagnosed and treated. I just want to finish thanking all the societies involved in breast cancer, patient advocacy groups, the Transforming Breast Cancer group at the European Union for working towards improving breast cancer patient outcomes and reduce disparities in access to care. Thank you.
Bardzo dziękuję. Ze względów...
Thank you very much. For security reasons today and in the nearest future, we cannot really have too many people here assisting us technically, so we cannot show you any slides, unfortunately. But now I will give the floor to Mr. Jürgen van Pret, our second guest. Mr. van Pret, you have the floor, sir.
W trybie online.
Are you connected?
First of all, I would like to thank you for this opportunity to speak on behalf of the Think Pink Europe, and that for a very specific reason. Think Pink Europe is an umbrella organization, so we unite 35 breast cancer charities from almost every European country. And we feel that the day-to-day experiences of breast cancer patients are very often not included into the political debate. So it's important to give a voice to all these women and men who live with the disease every day. So they have an important position to teach us what can be done better to improve healthcare and equality of care in Europe. So thank you for taking this initiative. Thank you for the opportunity. So during a couple of minutes, I would like you to focus on one mind opener. If we look at the figures of survival rates for breast cancer, we see huge differences in Europe. We see differences between countries. We see differences between the regions within the countries in the EU. And these differences in survival rates after 5 years, there are sometimes up to 30%. So it depends very much on where you live in Europe, where you are treated, if you will survive breast cancer and how. So this huge difference, it's unacceptable. I hear you thinking now, well, this is all about budget. It's about how much a specific country can invest into healthcare. And you are right for 50%. And this is something we cannot solve in just a couple of years of economic evolution. But that means also that the other 50% of the problem is not about money, is not about the budget that is spent on healthcare. So I would like you to focus on this aspect, on this 50% of the problem that we can change together. And to explain in lives, we talk about around 15,000 women that should not die of breast cancer in the EU this year. And we talk about another 15,000 women and men next year that shouldn't die of it. And we strongly believe as organizations that two aspects could be very crucial for this. The first one is exchanging best practices and helping them integrate in local policies. The two aspects of this sentence are important. For instance, working in a hospital as a breast clinic with a multidisciplinary team, a team that consists of all the healthcare takers involved to discuss and decide together about all the aspects of the treatment. European studies have learned us that this working method means a difference up to 12% in survival rate. And so while some of the countries have been very successful during over 15 years of improving their methods on this, other countries within the EU are still working in the old-fashioned way. So let's set up more programs and collaboration to exchange these best practices. Organizations like ESO, the European School of Oncology, and others, but also the EU have made some great programs on this already, but we need to accelerate and we have to be much more specific with dedicated programs on this. We must, and this is also very important, we must also stimulate member states to integrate these best practices into their national policy. This is very important. The second aspect that I would like to highlight is to assure for every member state the same complete access to the best medicines and treatments that are available. Although we realize that it's up to every individual member state to decide on their policy on this, we strongly believe that the European initiative on equal access within the EU could have a huge impact. So do we ask too much to pharma industry if they want to have access to the complete European market to commit to deliver to everybody within the European market? As we have been very successful on the European scale with consumer rights, why shouldn't we develop the same path for patient rights? I know it's easier said than done, and we do understand this difficulty, but I think that it's also unacceptable that some medications or treatments are not or much later available in always the same member state. This is also closing the gap on healthcare. This is also about equality. So, dear members of parliament, let's focus on what we can solve in the next years. The EU has achieved some great things during my life, but I want to see the next level in the near future. And I personally believe there is a momentum in the next year. COVID-19 situation is leading us to the importance of collaboration and exchanging best practices a lot quicker. So there is a message in every crisis, and we are much stronger together in fighting huge healthcare issues such as this virus, but also such as beating cancer. So let me conclude on this. I have understood that there are no slides, but 1 in 9 European women will be confronted with breast cancer during their lifetime. And it feels, as we have sometimes a pandemic situation, during a whole generation. So let's try to make the difference together. So this is not the case for the next generation. Thank you.
Bardzo dziękuję za...
Well, thank you very much for your presentations. Now we shall move on to coordinators. Remote connection. Cindy Francis.
Thank you, Chairman and dear colleagues. I would like to thank the two speakers for their excellent and interesting interventions, for sharing your views with us. And the focal points are clear and have been mentioned also by you: early detection, screening, equal access to high quality treatment and medicines are all essential. We need proper education and regular quality control. And unfortunately, disparities still exist. There are huge differences between regions and member states, and there is a significant social gap too. And I would like to raise two topics. First, I want to talk about the psychological aspects of breast cancer. Proper psychological support is needed in all stages of the disease. Let's not forget about aftercare, and the psychological aspect of the physical consequences of the treatments deserves extra attention, certainly for women. A second point I want to highlight is the importance of self-examination. Yesterday, I read an article stating 1 in 2 British women don't do regular self-examination. These awareness raise campaigns are not only essential towards women, but also for our male population. And my concrete questions will be: how do we increase the psychological and social support for breast cancer patients? What do patients need? And my last question: how can we better ensure the participation of all citizens to screening programs and the necessary early detection? What are the best practices we need to roll out across the EU? Thank you.
Bardzo dziękuję.
Thank you very much. I'm sorry to have to remind you that you have 1 minute and a half only. Ms. Moretti.
Moretti is not connected.
Okay.
Mr. Stefano Tarino, 1.5 minutes.
Dziękuję, Pani Przewodnicząca. 30 years after the Iron Curtain was lifted, an invisible curtain still runs through the member states of Europe, and that's the curtain of health, of varying standards, of varying availability of treatment, of varying prevention measures. This is so varying on prevention that in my country, in Romania, in other countries like Bulgaria and Latvia, prevention and screening for breast cancer is only done for 10% of the cases, whereas in the Nordic countries, the percentage is more towards 90%, and EU average is straight in the middle with 58%. So how do we tear down this wall, this curtain on various access to treatments, to drugs, and to prevention across Europe? I like very much what Dr. Van Praat said, that every member state should have equal access, and when breast cancer is identified, for the 1 in 9 women that he spoke, we cannot hope that they flip a coin and they just hope that they were born on the right side of the border. Thank you.
Bardzo dziękuję, Nicola.
Thank you very much. Now I give the floor to Joël Melin, ID, France, online.
Oui, merci, monsieur.
Yes. Thank you, Chair. Ladies and gentlemen, thank you for your testimonies. Breast cancer is the first cause of death amongst women. It's rarer amongst men and transsexuals. Now, within the framework that we're talking about here, research and prevention, which are the two active poles of any medical action undertaken, are what are of real interest to us. Now, there are some early forms and invasive forms of breast cancer which require a very special and targeted approach. Sorry, I seem to have some connection problems. Bear with me. This is in particular the case when it comes to fundamental research into the etiology of cancer and genome testing. So in concrete terms, how do you think we can promote further research in that direction? In terms of prevention, we have screening. How can we uncouple screening from financial resources and the healthcare coverage of each member state? It's not really possible. We have to respect the healthcare sovereignty of each member state. But what economic access should we support in order to activate a system of equal prevention for all? In particular, given that the COVID pandemic is bringing the social welfare protection systems of many member states to their knees. We have to say that. Thank you.
Bardzo dziękuję. Michelle.
Thank you very much. And now Ms. Michelle Rivasi, France.
W trybie online. Nie, czy na sali?
Are you in the room or online?
Alors, moi effectivement...
So yes, breast cancer is the first cause of death amongst women. Yes. Now, against that backdrop, I have two questions. First of all, on prevention. It is true that there are vast numbers of women who experience breast cancer. What are the risk factors that have been identified which result in development of breast cancer? It would be really great to see a map of Europe as a whole and have a look at whether in certain countries or certain regions or certain social strata there are more cases. Now, I'm bringing this up because one study was conducted which showed that women who work night shift are at much greater risk of developing breast cancer than women who do not work during the night. So I think labour conditions also have an impact on risk and incidence. And then secondly, what about integral, holistic medicine? A lot of us have talked this afternoon about psychological support during chemotherapy. Now, as part of research programmes, couldn't we also focus on a more integrative type of medicine, which is complementary to traditional conventional medicine?
Zabierze Margarita de la Pisa Carrion, ECAR, Hiszpania.
Thank you very much. Margarita Ecayon, Spain.
El éxito de la lucha contra esta enfermedad se ha
The success of fighting this disease hinges on providing customised treatment, which takes account of the specific patient and the specific type of cancer. So there needs to be very close communication between patients and doctors so that the concerns of the patient are reflected in the treatment. The therapies are increasingly specific. What about antibodies, for example? So how can we take account of that type of thing when healthcare systems are stretched for time and protocols are increasingly tight? What about prophylaxis as well? Molecular biology has made a lot of progress. Can we use that to improve screening and prevention? Thank you very much.
Bardzo dziękuję. Katarina Koneczna.
Thank you very much. I give the floor to Katarina Koneczna.
W trybie online.
Dobrý den.
Good afternoon.
Mamy problemy z połączeniem.
Czy mamy?
We have some problems connecting, apparently.
With my connection, if you hear me only.
Słyszymy cię, nie widzimy cię.
We can hear you, but we can't see you, says the chairman.
You can have no translation. Please speak in English. Thank you.
I don't know where is the trouble because, but could I speak Czech and you didn't see me or not?
I'm sorry, we only can hear you.
Prośba po angielsku, jeśli nie mamy obrazu.
Please speak English because we can't ensure interpretation without a video connection.
To director from Think Pink Europe. Thanks for your work because I think you are in the beginning of all the campaign and you are in the beginning that we have so many information about this type of cancer. It's your work, and the patients in informations about the cancer are the most important stakeholders for me. In the other side, I need to say that we support your steps, and we understand that the prevention needs to be in the beginning. And but for example, in my country, we see that the prevention is from 40 years only, and I think that we see now in the numbers that we have a more and more youngest women who had these problems, and I think that we need to start discussing how could be prevention for youngest women in whole Europe, because if we know that there is or there start a problem, I think we need to solve it, and this is only what I want to say. In the other side, the second big issue is now the treatment, because you can see in some member states that the going for treatments, it's a long way, and sometimes we spend months or years. Then the women have a possibility to take it a good treatment. That means that we so need to work with this. But yes, thank you for your intervention today, and we support you, and we are in your side, and I hope that we will cooperating not only for this short briefing, but for next days. Thanks a lot.
Bardzo dziękuję. Oddamy teraz głos.
Thank you very much. Now I give the floor to our rapporteur, remote connection. Veronique, you have the floor.
Thank you, Chair. As the rapporteur, I would like to stress the fact that breast cancer should be seen as a model, an indicator to assess the implementation of the future cancer plan. And I will give some concrete examples some of you have already given. First of all, we could deepen cross-disciplinary cooperation on breast cancer research, especially on still unknown risk cancers and on targeted treatments. We should revise the Council recommendation on cancer screening and ensure implementation of free mammography programs. Ensure that every patient has access to adequate treatment by a certified multidisciplinary team meeting predefined quality insurance criteria. You have already mentioned that we have to ensure equal access to affordable medicines, ensure more attention to the quality of life for the patients and families and patients' empowerment, reinforce the guidelines for equal opportunities for breast cancer survivors in terms of return to work, reproductive health, and insurance takeout. And finally, develop breast cancer registry process in Europe to collect breast cancer data. Thank you very much for very inspiring comments and questions.
Bardzo dziękuję.
Thank you very much indeed. Is Alexandra Moretti perhaps with us now? There have been technical difficulties. Can you take the floor now? Doesn't seem to be the case. It's not going to work, is it? Let me ask about Mr. Olivers, Antoni Olivers. Are you online with us? Doesn't seem to be the case. Therefore, I give the floor back to our experts. Please stick to your time. I give the floor to Dr. Rubio.
We are discussing, I think there are many issues we are discussing here. Of course, prevention is an issue, and it's so important that we develop mammographic population programs for everybody in the years where the breast cancer is more common. I think it's important also to work on lifestyle programs. So so women will reduce their risk of having breast cancer. It's important also support groups, and I think we all agree that in all the pathway of treating breast cancer, we will need support from psycho-oncologists, nutritionists, holistic. I mean, I think those parts are really important to have. I think, you know, many of the prevention, the screening, the diagnosis, the treatment, the research can be done in the breast units. We can get all the breast data that can help our patients in improving treatments and diagnostic procedures. Of course, there is a huge difference in the access to care, in the access to screening, but I think that we have the time now that can manage all these differences across Europe. I think it's important to realize that we are facing a very difficult time now in Europe with the COVID, but I think that if we work together with all the stakeholders and all the societies, patient advocacy groups, politicians and everybody, we can find a way that we can approach all these disparities and have programs that will help improving our breast cancer patients' outcomes and lives.
Bardzo dziękuję. Pan Van Pret.
Thank you very much. Mr. Van Pret, 3 or 4 minutes, if you'd be so kind.
Things have been highlighted in that are very important, and if I would like to make a kind of a resume of this, and I think if you think about what should be the role of the European level, I think it's much more, even now, coordination and stimulating collaboration. I know this is, once again, easy said, easy done. It's not that easy, of course. But I think give me an example for research. We have so many great researchers for the moment that are doing fantastic things with the support of the European level and a lot of states. But what we see is that during the research also, there is not a lot of connection during the process of the research. So even there, making connection between researchers and much more collaboration and coordination could be very, very important to have quicker and better results. A second thing, I think one of the members of parliament was explaining about healthcare sovereignty of the states, of course, and I'm fully aware of that. But of course, we can stimulate, like we do it in other fields, we can stimulate our member states as well. So it's not always about saying what states have to do. It's also stimulating and proving and showing also the things that can improve the situation. We have come a long way. You know, we were talking about awareness, and we almost forget that, let's say, 25 years ago, we could almost not speak out the word cancer. So about awareness, we have gone a long way. There's still a lot to do. And I think the next big step after awareness is prevention. Some of the members were asking about we have to focus also on what we can do on prevention. Well, it's a work that is also much easier said than done, but it's healthy lifestyle. It's a very important one, and it's also focusing on what we can do. If we look to the aspect of a very complex situation of breast cancer, there is also a big part that we don't have enough influence for the moment on, but there is a part that we can influence. So even in this prevention aspect, let's try to focus with healthy lifestyle promotion, what we eat, what we drink, what we do as sports or promotion of healthy lifestyle in general. It has such a huge impact also on cancer in general. And I think the Beating Cancer plan that is now on the European level, both BRCA Life is so important also. This is a huge, important step to go forward now with a straight planning and focusing also on the right priorities, focusing on the 50% that we can change and focusing on the things we can do.
Bardzo dziękuję wszystkim Państwu za dyskusję.
Thank you very much for this debate, very quick and smooth within the time limit. This discussion, and indeed everyday life, goes to show that there are huge differences when it comes to access to prevention and checkups. It's enough to cross the border to have a situation where on one side of the border 60% of women are being checked up, and on the other side of the border 10% or 5% under the screening programs. Unfortunately, this is true. There is no equivalent of Schengen zone when it comes to healthcare. And COVID, unfortunately, opens our eyes to the fact every day that we will not win this battle alone.